Dr. Dev Banerjee. I'm the Pommy Sleep Doctor. I'll be explaining the art and science of sleep so you understand everything that goes on when you're asleep. Today we're going to talk about snoring. Now lads, not boring, snoring, the noise that's keeping your missus awake, And I know what you guys like to go to on holiday. Camping, no more. We're going to get it fixed, okay? The anatomy of the snoring, well, it could be either nasal, back of the palate, or back of the tongue. So there's multi-level. So you got to understand the anatomy and the physiology before you realise how you're going to treat it. A lot of gadgets out there, things you stick up the nose, spray the back of the throat, they don't work. They're wasting your money. So listen up. If you're quite nasal, you've got lots of polyps and from hay fever, that might be causing a lot of turbulence in the nose and the back of the palate. Get that checked out by a specialist. An ear, nose and throat person would be an excellent person to do that. We might need some nasal sprays to reduce the inflammation of all those polyps. Certainly if there's a big floppy dangly bit in the middle, it's called the uvula. That can obviously wobble in the wind and cause a lot of turbulence, and that's where a lot of the snoring comes from. The soft palate, sometimes hang like a set of curtains, and certainly that can wobble in the wind as well. The tongue is the important part. Obviously, if you've got a big, broad-based tongue and it's just in the way, there's not going to be much space between the palate and the tongue. All right? So there's a lot of turbulence and there's a lot of vibration going on. Particularly if you snore on your back, the tongue falls back of the palate, you get like a ball valve effect, and all that noise, that's where it's coming from. Disturb the hell out of your wife. Now, a lot of you guys, you might even stop breathing. It's called apneas. Apnea is a term that means without air. Now, if you have an apnea, that's sleep apnea. Why is that important? Well, it annoys the hell out of the missus lying next to you, but also disturbs your sleep and your oxygen levels go up and down. If you have obstructive sleep apnea, must get it checked out. Can be a health issue as well. So, how do I actually know if I'm snoring and if I have sleep apnea or not? Well, there's some clever apps around actually. There's a Snore Lab app that a lot of my patients like to show me, and they show me the data, and the snoring is epic. I can actually record the snoring as well. And so the missus is, the humiliation goes on really. But have a sleep test, and you can take a piece of kit home through the Dr. Levi Sleep Clinic. You have a thing on the forehead that measures the sleep quality, a thing up the nose that measures the airflow, a belt around the chest and a belt around the waist, and a thing on the finger. That will check your breathing, it'll check your snoring, and see what position it's in and whether it affects the sleep. And you can have that done through the clinic and have it done at home, bring it back the next day, we can download the data. If you've got a lot of sleep apnea and there's a lot of stopping breathing, well, no wonder you're knackered in the morning. Yeah, oh, that makes sense. Well, one of the ways of treating that is a little blower machine called CPAP, continuous positive airway pressure. A little box that lies by the bed, it blows air through the little tubing, and then you wear this little mask over the nose. Some people might need it over the mouth as well, and it just keeps the airflow nice and gently and stops all that snoring and stopping breathing. Technology's improved a lot. No, you don't look like Darth Vader anymore. You look like Luke Skywalker. Anyway, the lights are out. Your wife's not going to notice. She's going to sleep well. Happy wife, happy life. So that's CPAP. But if you've got mild sleep apnea and it's mainly snoring, one other option is a dental device. It's basically a device called a mandibular advancement device that brings the jaw forward. So it opens up the airway at the back, and there's less of that reduced space between the palate and the tongue and all that turbulence, and that will improve the snoring as well. But make sure you get it fitted properly. Don't buy one of these cheap stuff online for $69 or $99. Doesn't fit, plops out middle of the night, dog eats it. Where is it? In the garden next to it, dog poo. All right, so get it properly measured and made up. Dr. Levi does that. He's very good at it. Look, these devices are expensive, but if they're done properly, it works. It's money well spent. There's a lot of interest in laser at the moment, back of the palate. Certainly if you've got sleep apnea, won't do laser, won't work. Certainly if you've got snoring mainly on your back, won't work. If it's mainly the palate and you snore in any position, side and so on, then front, then laser might be an option, but make sure you get it checked out by a proper doctor or a proper dentist like Dr. Levi, just to see what the outcomes could be. Might be convenient, but cost a lot of money, but make sure you get proper advice on that. Surgery, well, certainly if you've got big tonsils and they just sit there in the back of the throat like two big avocados, then take them out, because obviously that's going to act like a ball valve effect, and that's why you've got sleep apnea, and that's why you snore like hell. So go and see a proper ear, nose and throat specialist. We've got plenty we work with. They're very good. They're very good. So call us and we'll let you know who the best ones are around. Either way, we need to stop you snoring because you snore like hell, and you know why blokes are XY, because if you don't sort it out, the missus is your ex and you're wondering why. So come to Dr. Levi's Sleep Clinic, get a home sleep test done, and then we'll go from there and we'll work out how to fix your snoring. Over and out. Cheers.